Excellent. Good afternoon, everyone, and thanks so much for joining the National Telehealth Webinar Series. My name is Danielle Lauder. I am the Program Director for the Northeast Telehealth Resource Center, or NETRIC, as is much easier to say, and as all of our colleagues and friends like to call us. We serve all of New England, New York, and the northern part of New Jersey. On behalf of all 14 telehealth resource centers across the country, we'd like to welcome you to today's webinar, and we hope that you'll enjoy this one as well as many more moving forward. We offer these monthly, along with our colleagues from the other telehealth resource centers. We're excited to host this month's session, which dives into the web-based platform that we have been utilizing for a few months and now is available across the nation for GIS mapping of telehealth services across the United States. Next slide, please. Before I introduce today's presenter, I wanted to share a brief overview of the telehealth resource centers for those who are maybe less familiar with us. This map shows our presence across the nation. There are 12 regional telehealth resource centers, which collectively cover all 50 states and the Pacific Basin. If you've not yet had the opportunity to connect with your regional TRC, please take a moment to find them on the map, and we hope you'll reach out to see how they might help you with your telehealth efforts. There are also 2 national telehealth resource centers, our colleagues at the Center for Connected Health Policy out of Sacramento, California. They focus on the ever-evolving landscape of telehealth policy, and our friends at the Telehealth Technology Assessment Center, or TTAC, out of Anchorage, Alaska, provide impartial assessment and feedback on the growing spectrum of telehealth technology. The telehealth resource centers are funded through the U.S. Department of Health and Human Services, Health Resources and Services Admin Office for the Advancement of Telehealth, which falls under the Office of Rural Health Policy. The TRCs have been in existence for more than 10 years and were established to provide assistance, education, and information to organizations and individuals such as yourselves actively involved in providing or interested in providing medical care at a distance. Our mission is to expand availability of healthcare to underserved populations through telehealth. And because we're federally funded, the assistance we provide is impartial and generally free of charge. Next slide, please. Just a couple of logistics before we get started. You'll notice that you are all muted just so that we don't have feedback, etc. And so that you can take notes on your keyboard without having the excess noise in the background. If you would like to grab a crunchy snack, etc., no one will hear you. If you do have questions for our speakers, please use the Q&A feature at the bottom middle of your screen. Just type in your question and we'll do our best to answer those questions at the end. Or if there's some simple stuff that we can answer, we'll type that right back in right away to make sure that your questions are answered. And then if you have technical questions for our presenter, we'll have a Q&A session at the end. If you have technical difficulties today, please call 317-517-3961. And now, without further ado, I would like to jump in and introduce our speaker for today. Our topic is Telehealth Connect, Working for You, Use Cases that Help with Reporting, Engagement, and Collaboration. Our speaker today is Steve Sedlock. He's the Executive Director of GeoHealth Innovations and developer of the Telehealth Connect GIS mapping application. We've had the opportunity to work with Steve for several years now, and he certainly has made a huge difference in how we look at our data, but also has a strong history in web development and basically utilizing those skill sets to develop tools for looking at data in a different way across public health, certainly in respect to telehealth, etc. So really, I am going to save much of the time for him and his presentation. So thank you so much, Steve. We really appreciate you being here with us today, and have at it.
Very good, Danielle. Thank you for the kind introduction. Today's objectives, one of the things is not only are we going to go over some use cases, but we're actually going to provide an overview and a demonstration of the application. Today is the day that we are going to release the application out to the public, and so that will take up the overall demonstration will take up a little bit of time. So it'll be more than just the use cases, but it'll give you a good overview of this new app. So we'll start with an overview, do the demonstration, hit the use cases, and then provide an opportunity for questions and discussions. I will take an occasional moment at a few points during the demonstration to field any questions that might come up. We'll check the chat box, and we'll also have time at the end. So I'm going to provide a brief history of this application. In the fall of 2012, through the vision of Kathy Wibberley and the Mid-Atlantic Telehealth Resource Center and the people at the University of Virginia, we launched this app for the Mid-Atlantic region. And back then it was called Find Telehealth Providers. You may have heard of that name before. We did an initial launch in the Mid-Atlantic region back in the fall of 2012, and that included 8 states and the District of Columbia. Starting about early 2014, we expanded to the Northeast and brought in an additional 7 states, and those were through the vision of Danielle Lauder with assistance from Andrew Solomon. We're able to expand into those to the Northeast area. So we were in 15 states plus the District of Columbia. Back in the fall of last year, funding was provided for a national expansion. So we are going into all 50 states, and today we are going to launch. So that gives you a little bit of background on where we have been. The key features of the app, this is predominantly our vision in terms of our user community are those with a stake in telehealth services. It's not specifically oriented toward the patient, but it is oriented toward providers, health planners, health systems, federal and state telehealth organizations. So it has a broader, more of a policy and planning view as opposed to a direct care. We do have some ideas and visions down the road for potential patients utilizing the app, but for the most part, it is for the user group that I just went through. In the app, you can determine telehealth equipment, the telehealth equipment funding environment. You are able to produce maps and lists of telehealth sites for any kind of grant application or educational material that you might have. You can view the Medicare reimbursement environment. You can find patient referrals where there could be other telehealth services and other specialties being provided outside of a particular organization. You can perform community notification through social media. We can perform telehealth provider site search, including current telehealth environment in a particular region and potential expansion planning. So that kind of looks at the health planning side. You can add and update new and existing telehealth provider sites, and we'll talk a little bit about that at the end, how you can add your sites in. Map display and navigation tools that are very standard to what you've used in Google Map and other apps. Navigate to a particular address. You can create what we call bookmarking, with a one-click zoom to an area of interest. You can filter by state, specialty, hub, distance. Select individual sites using the mouse click or a selection box. And visit, you'll also have links to telehealth provider sites when they're provided. Coming this fall, we are going to have a national coverage of broadband for the entire country. So that will be an added resource that will be coming soon. And then in terms of determining other government programming opportunities in terms of federal funding, we will be bringing the USAC and the USDA telehealth program layers coming in 2018. So without further ado, I'm going to go to the app. And what you see is Telehealth Connect. And I'm going to give the URL out at the end. Essentially what you have, and I'll turn on the telehealth provider sites that we have so far, is you have a mapping interface, and they are standard tools similar to what you find in Google Maps and other operations. You can zoom in and out. You can also use, if your mouse has a scroll wheel, you can utilize that. Turning up the wheel will zoom you in, pulling the wheel out back toward you will zoom it out. And you can also do dragging. So this is a click, hold, and drag to pan your way through various parts of the country or wherever you want to go. It's always a good idea in terms of utilizing this, and I kind of would expect our users to be focused in on particular areas. And we have, everybody's going to have their own area of interest. For example's sake, I'm going to go ahead and zoom into the Mid-Atlantic region and bring in some of the states that are there. And I can actually zoom to this at any point by just creating a bookmark. I'm going to turn that one off and bring it back. So say this is just an area in the Mid-Atlantic. I can just add my Mid-Atlantic bookmark, and then say I wanted to navigate away to the western part and look at some sites up in the upper Midwest. I can always switch back to the Mid-Atlantic and slide back in like that. So that are just some of the navigation tools. And these bookmarks will always be here in the event that you want to navigate away from this map. They will always be, that bookmark that you place there will always be available in the weeks and months to come, and allow you to stay within your area of interest. So let's go back to the layers as I demonstrated before. You can turn on and off telehealth providers. We can also, and just to give you a little bit of background, these facilities are are the brick and mortar, if you will, of where telehealth technology exists. So these are not necessarily individual providers, but they are facilities that conduct telehealth and provide it or receive it. I'm also going to turn on the Office of Rural Health Grant Eligibility layer enabled with Medicare eligibility. These areas appear in the orange-yellow color. The layer shows areas that are eligible for HRSA grant funding with regard to rural telehealth expansion. This area is, and the light just went out on me, but that's okay. This layer is enabled to inform the user of the Medicare reimbursement environment for telemedicine. I will demonstrate this by just clicking on an area. So I can zoom in to a particular area that, say, does not have telehealth, and I can click on a particular county. And actually, I'll bring one down a little closer here. Look at Greenbrier County, and I find out that in this census tract within that county, you have both reimbursement available from Medicare, as well as you are eligible for grants through the Office of Rural Health Programs out of HRSA. This layer can also be changed in terms of its view. I can change the transparency, kind of move it around so that you can see what the underlying conditions, what the underlying geography is. So if you don't want to see it all, if you need to see what's underneath these areas and get a little better understanding of the geography, you have that tool available to you. So I will turn off that ORHP layer and begin to do a little bit of filtering. So here we zoomed into, then I'll go back to my Mid-Atlantic slide. And let's begin to do some filtering by attribute. And one of the more important tools that you will be utilizing as you use this application is filtering by state. And in this example, I can show only those sites that are in North Carolina. And this allows me to use multiple states. So I'll go ahead and bring in Virginia. So the demonstration here shows, and based on that filtering, all the telehealth sites in our database that are in those 2 states. You will also notice that this is, as you utilize the tool, that it does not zoom to the geographic area of the entire state, but only to the geographic area where telehealth exists. And I'll show an example of that here shortly. We can also add a 3rd state, just for example's sake, and look at Kentucky. And that zooms out and brings in Kentucky. So here we have the Kentucky sites added to the 2 previous queries from Virginia and North Carolina. I can also scroll down and get to see the listing of all of the sites. And this shows all of the sites that meet that criteria. Virginia, Kentucky, and North Carolina telehealth sites. And I can look at these and sort by the name of the facility, the state they are in, as well as the setting type. And the setting type indicates whether it's what type of facility it is, whether it be a hospital or health system, an academic medical center, a rural clinic, an FQHC, a home health facility, and nursing facility. All of those are what we call setting types, and I'll show a little bit more about that here shortly. So I'm going to go ahead and do, in terms of the filter that we just created, I want to bring in, say, for those 3 states, hospitals and health systems. So I'll go ahead and click that and add that to the filter. So that narrows down our search to hospitals and health systems in North Carolina, Virginia, and Kentucky. And again, as you make that query, the list changes. So that's narrowed things down to just what we've asked for. And these are the different types of settings. If you're not familiar with the setting type terminology, these are all the different types of settings that can be queried on. We can also look at specialty area. And I will go ahead and select. And these are all the different specialties that are available to us. We can look at psychiatry and mental health. So that narrows the list, the display even further, and narrows the list down further. From this, I can click on one of the sites, and I see that I've selected Inova Mount Vernon Hospital, and this is the information that comes to the top on that click for Inova Mount Vernon Hospital, and has its address, has its specialty areas, various information, and I can actually go to their website just based on that click. So I clicked on that and was able to bring up their website to get more detailed information about their services and the facility itself. with that, I was going to stop briefly, and if Danielle and Becky were going to monitor the questions, as if there was any one that I can answer or help with.
Steve, there's actually a question around the source of the data for the current telehealth sites. So certainly if you want to answer that, there are a few different data sources, whether you're talking about the actual telehealth sites or if you're talking about data layers like the Medicare eligibility, et cetera. So if you want to speak to that a little bit, and we're happy to jump in as well. And Kathy Webberly is also on, so she could jump in too.
Sure. We have worked with databases that have been existing within, say, the organizations that we've worked with the Mid-Atlantic region and the Northeast region. We have also provided the opportunity for organizations and sites to bring in their own data and add it either through a spreadsheet or through a website that allows them to manually add it into our database. It's a draft database that we actually eventually will post it up to the production database. But those are the primary sources of information that we get for the telehealth sites. The layer for the ORHP, Office of Rural Health Policy, out of HRSA, and the Medicare eligibility enabling that we have there are based on data sets that come out of not only HRSA, but the US Census Bureau, and I believe those are the only two organizations that we utilize for that data, but we work with the HRSA data warehouse and the most up-to-date Census Bureau data, particularly with regard to their metropolitan statistical areas that help create that Medicare eligibility enabling. I can go into further detail later if there's still additional questions about that.
Sure, and there are a couple of other questions. Steve, if you would like, we can keep moving forward with your presentation, or we can take the time to answer the questions now.
Let's go ahead and just take a couple and see if I can answer them quickly.
Sure. So I think this one's a fairly quick question. The site types that appear look to be only spoke, unknown, or hub also. This prompts the question of whether only hub and spoke model telehealth providers and participants will appear.
They have the option, and maybe this is where we can bring in Kathy and maybe Danielle as well, but they have the option to identify themselves as either a spoke, a hub, both, or unknown. And if they don't, I think the unknown is left open just from the standpoint is that somebody might not completely understand or know exactly their relationship with a hub or spoke. So that's why that appears in our data. And if Kathy wants to add anything or Danielle wants to say anything, that's fine. I think I might have been able to answer that as it was. So. Yeah,
this is Kathy. Just real quickly, I think we want to try to capture all providers. So whether you are part of a network or part of multiple networks or independent is irrelevant to whether you can be added to the map. But what we do want to do is if you are part of a hub and spoke network, or if you're, and some of you are part of multiple hub and spoke networks, that you let us know that so that we get a sense of what the size of the network is and who's involved in that network.
Yes, and I would echo that. We want all comers, so you know, whether it's not necessarily, if you don't feel it's applicable to you, you're not a hub or a spoke, please still do put in your data. It's more for us, as Kathy mentioned, to collect that level of data for folks who are a hub or a spoke. Steve, another question, definitely a you question, because I can't answer this one. Are you providing any API to query data by other apps?
At this point, we are not. We are strictly, we are staying, at this point, we're not going to be doing that. That is something that we could do in the future. But as of right now, we're in terms of being able to integrate with other apps, we're not there yet. We will be eventually.
I think if there is a demand for an API pull or push of that data from anyone, if you could just let us know, that would be very useful, so that if there were, a lot of entities wanting to be able to pull the data for whatever reason, then we can certainly put that up higher on the priority list.
And Steve, we actually have several other great questions coming in. I'm just doing a checkpoint here. Would you like to keep moving forward with the demo? Would you like to continue with the questions?
Let's go ahead and move forward, and I can hit those at the end.
Okay. We promise we'll get them answered, guys.
Absolutely. And thank you for those great questions. One thing that you can always do, so we just did our filter there of 3 states where there are hospitals and health systems providing psychiatry or mental health in the telehealth world. I can always do a reset of those filters, and it will zoom me back out to the entire geographic region of telehealth sites that we have so far. Say you have an address and you want to know what telehealth services are available around that address. I can go ahead and type in an address. And I'll go ahead and expand it out to 60 miles. And then I'll go ahead and do a search on that. And what you see is X marks the spot at 61 Meadowbrook Road in North Plainfield, New Jersey, and the telehealth sites that we have in our database that are within 60 miles of that address. So this is one of those where you could have a potential referral, you had a patient or that needed telehealth services in some shape or form. You can do that, and then you have a listing below that of those telehealth facilities where providing and what they are providing. As many of us know, telehealth, psychiatry and mental health is one of the bigger users of is a specialty that's often found in a lot of these telehealth facilities. So that gets you a address and allows you to zoom in there. And I can go ahead and click and do a reset and start over again if I wanted to. So let's go ahead and do a little more in terms of maybe helping out with some level of reporting or map generation. I can go back up to my filter by attribute and say I wanted to look at sites in New Jersey and Pennsylvania. Well, I've got those listed right there, and they're shown in the list. And I can go ahead and export this out to a map. So by clicking on the export map, it takes a few seconds. But eventually you get another web tab that shows a map with those sites mapped out for you. And if you were to right click, you can save the image. You can just directly copy the image and put it into a document or a PowerPoint. So that works very well. And say you needed to do some reporting out, you can export that list. It will appear somewhere around your browser. And you can see the facility names, the main contacts, where they're located, their websites, their specialties, and that is directly into an Excel format. So I'll close that, and I will next touch a little bit about the social media integration that we have. If you want to make an announcement out onto your web page with regard to you updating a site or adding a site or letting people know through some level of social media, you can go to Facebook and post directly to your Facebook page. That's me there, and this is, we can edit that, but you can put that right out into social media. You can also go to Twitter and do the same if you have a Twitter account. So those integrations are available to you. I would like to go ahead, I'm going to hit some of our use cases here shortly, but maybe we can hit a couple more questions before I go into that, Danielle.
Sure, and these are pretty relevant, I think, as we look through the application itself. And Kathy and I can certainly jump in on this one as well. Steve, can you speak to who is the intended user of this app and what is the plan for the rollout to gain momentum in usage?
Excellent question. The user community are those that have a stake in telehealth, and our typical user is going to be anywhere from the provider or anywhere from the provider level all the way up to the federal level, in between with all of the health systems and the administrators of particular clinics, state health departments, looking at that particular type of audience, health policy people, health planning people that are interested in telehealth. The rollout to build and gain momentum is going to be largely through our social media campaign that we will have. We will also be presenting at conferences. We'll be running webinar series. We'll be working with each telehealth resource center to make announcements about this application and conducting training with that in mind. So we have numerous plans and how we've done it before in the Mid-Atlantic and Northeast. It's usually going to be a combination of all of that I mentioned.
Great.
And if Danielle and Kathy wanted to add, they can, but if they don't, that's fine too.
Yeah, I'm not sure that I would have to add a lot to that. I think really, as Steve mentioned, it's really any stakeholder involved or interested in telehealth. We certainly hope that this will not only be utilized to help identify specifically where sites are, if you're either a provider or you're looking to receive services via telehealth, but also if you're writing a grant, for example, and you want to see where there are gaps in telehealth and help to export some information to include in your grant proposal. We want our federal funders and a different number of folks within the federal government to be able to look at this information and utilize it for reporting purposes or to identify gaps and help inform the work that they're doing. So, and it looks like Kathy unmuted, so I'll let her take over from there.
Yeah, one interesting use case that we use a similar application like this at the University of Virginia is to actually identify potential spoke sites. So if we have a group of patients who are from a particular area and we don't have a satellite clinic or existing contractual relationship where that patient can go, we put in the centroid of those patients' addresses, look at what sites are available that have the equipment and the technology, and then we contact them and say, hey, would you be willing to work with us to be a spoke site, allow your patients to come to that site to receive services? So that is one application.
Perfect. Great. So then we have another question. and there's actually a couple of questions that are very similar, so I'm thinking that maybe answering one of them might get to both. Do you have the ability to identify what states the providers are licensed in?
We have, our focus has been on identifying the sites, not necessarily identifying which providers are in that sites. We're identifying what I would call the brick and mortar of telehealth and where it physically exists. We have not, but we have some ideas in terms of bringing in that provider data to make that information available. That is a little more, that's a little further down the road. One of the things that we do make available is the facility website when it is available, if in fact they do have a website. Most everybody does now, but you can click on the facility website and find out a little more information about what providers are there and what where they're licensed. But that is something that we've thought about.
So another question, how do you identify the individuals in populations that are underserved?
Say that one more time, Danielle, sorry.
How do you identify the individuals in populations that are underserved?
So we bring in health professional shortage areas in order for us to be able to afford that Medicare eligibility enablement of that ORHP layer. We need to bring in what is commonly referred to as HPSAs, health professional shortage areas. In terms of medically underserved, that is a layer that we could potentially bring in the future. We have focused mostly on looking at the looking at the environment of telehealth and what are the factors that could enable it to expand, or where there could be obstacles. But a medically underserved area or underserved populations is something that we could add relatively easily. We'll have some discussion about that with the team. That's something that we've worked with before and can add.
Sure. And all of you here today and your colleagues and others across a wide variety of folks who may be end users of this particular app, it's not to say that we're always going to have the capacity to add every layer, but if it exists and you feel like it would be helpful to add to, or if you have ideas on how to enhance the application, please let us know. Steve was gracious enough to provide his contact information at the end of this. So again, we really want to ensure that this is a useful tool for a different number of types of stakeholders. So please keep in touch. We hope that you'll use it and provide feedback as you do.
Excellent.
So just another check-in. We have a couple more questions. Do you want to continue on with the case presentations, or would you?
Yeah, let's go ahead and do the case presentations, and I'll field the questions at the end.
You bet.
All right. So I want to talk a little bit about the use cases. One of the use cases is reporting. And you can report at a number of different levels, at the national level, at the state level, and I showed some of that at the state level. But say I wanted, I was a federal administrator and needed to take a look at things at the national level. One of the things I can do is I would say I wanted to look at only those telehealth facilities in the country that provide cardiology. So I can narrow that down and show those sites that have currently in our database, those that are just providing cardiology. And like I did before, I can export that map and put it in a document. Or more importantly, we all know how much federal government likes spreadsheets and tabular data. You can put that into an XLS and send it on off. And you can see the addresses, the contact information, the website, setting type, all of that can be put right in. And it looks like right now we have 27 that are listed as such. So that's a very quick example of reporting and how quickly you can do that. Another is kind of collaboration, and I'll do this. I'm going to move up toward Danielle's area and hit Maine and see the sites that are in Maine, and you can see those on the map, and then you can get them in the listing again. But say from Maine, I wanted to look at only those facilities that were providing OB, or gynecology. Well, that narrows that list down even further, and you can see those facilities that have those. But say from a visual standpoint, you want to look at see where there are potential areas where there might be a need for OB, and you're considering, or somebody's considering, either expanding into another facility or opening another facility or starting fresh. So I can go ahead and do an overlay of the ORHP eligibility with the Medicare enablement and do a click on a census tract. And you can see it's Somerset County. Say if there was an area up in this area seems rather remote and there might be a small amount of population up there, but there could be a need. You can actually look at and determine the Somerset, look at that census tract and look and see if you can in fact get reimbursed for telehealth and be eligible for some equipment investment from the federal government. When we click on the Medicare reimbursement, you can go right to that site and look at telehealth with regard to Medicare, or you can go right to the other HRSA site and look at the Federal Office of Rural Health Policy and get some information on them. Okay. So there's potential, so you may not want to necessarily open up a new facility up here, but it also gives you an idea as to where, and broadband will be something that we add that will really help understand the environment. You can see where other facilities you might be able to contract with or work with to obtain or send patients to that have OB telehealth either provided from a larger facility or actually whether they are a hub or a spoke. So that's just kind of a collaborative, giving you an idea of, okay, who can help? What's the current environment? How can I engage? And I will go ahead and do a reset. So that's collaboration and engagement. The last one I'm going to show you is a tool that is a neat little tool, and it works really well when you have a big network. But I'm going to look at a hub and spoke network, and this is a great visualization tool if you want to be able to demonstrate to somebody, okay, this is the extent of my network. I can go to the UVA Center for Telehealth, and that shows the UVA Medical Center and all of these spokes that UVA provides telehealth services to. And you get a listing, again, of those facilities that are there and are part of UVA's network. I think VCU, and this is, yeah, VCU Center for Telemedicine also has a similar network. Yeah, they have expansion. VCU has gotten fairly involved in the correctional health space and provide telehealth services to correctional facilities around Virginia. So let me slide over here. That's the extent of the demonstration that I wanted to show. This is, like I said, a visualization tool that can be a very powerful tool for you to show how a network might be, how big of a network somebody might have. So to access the site, and I believe Becky and Danielle I believe Becky will have access to the PowerPoint. That is where the website is. We are working with the National Telehealth entity, the National TRC, to establish this on their site. So once this address will eventually go away, but in the meantime, you can go there now and utilize the app. It will also, once we move it over to the National TRC site, this will, if you click here, you'll automatically be redirected to the national site. So that will be how that works. In terms of adding your sites, the website for that will be available next week. And it's a very straightforward, just fill in address and information, and we take that data and then bring it in to the app. We do obviously some vetting to make sure that all the data is legitimate. While you're waiting for that, if you had data that you wanted to provide us right now, we can still take it. We have a spreadsheet available, and I believe Becky has that. If not, I will get it to her. That's available in the interim while we get the next site up. But by next week, if you can hold off till next week, that's great. If you really want to get your sites up now, we'll be happy to take them through our spreadsheet approach. And we will go ahead. That's all of my contact information. Please feel free to give me a call or shoot me an email. I'll be happy to answer your question and guide you through any questions that you might have with regard to operating the app. Your input would be obviously very helpful as we do this launch and help us to make it a better app. So feel free if you have questions or comments or suggestions or whatever. So you have that available. I'll go ahead with 2:48. Let's go ahead and see if we can hit the rest of the questions.
Sure. So we do have a few, Steve, and I think a couple we'll be able to move through very quickly. What consideration has been given to patient-centeredness in the design and operation of this app?
I would say that that's probably not the best answer for that. That would be a potential answer for me. Kathy, do you want to take a stab at that one, or you want to push it back to me?
I can go ahead. So this app was not designed specifically for patients. There may be a time coming in the future where it is going to be for patients. But right now, it is really more for providers and policy makers to really understand the landscape of telehealth, and for people applying for grants to really understand what's out there in their communities and states.
Great. So an easier question, expected date to move to the national site?
We would expect to be redirecting everybody to the national site within a month.
Excellent. And so I think I just have one question left, and I've sort of saved it for last because I wanted to make sure that we first understood the question correctly, and then whether we want to unmute. But this is from Venkata. His question is, this information is needed to recruit providers and patients to test the capabilities and performance of an open access health informatics application. And that is his question.
Okay, I probably need to hear it again.
Sure. This information is needed to recruit providers and patients to test the capabilities and performance of an open access health informatics application.
So he's probably making a suggestion. Is that what I'm?
Maybe. That's why I wondered if we could Becky, is it possible to unmute folks now that I think we've answered every question so far?
I honestly don't know. I can play with it and find out.
And Venkata, feel free to type in additional detail if we're not getting to what it is you're asking. We just want to make sure that we're perceiving your question correctly.
Yeah, we as Becky does that, yeah, to re-emphasize, at some point we do see a patient engagement with the app, but as Kathy indicated, that this is for providers, this is for policy people, these are for health planners to understand the telehealth environment that they are operating in.
Great.
So if we unmuted everybody, yeah, I can hopefully get a little more.
Yeah, I haven't found a way to unmute the attendees, so they'll have to type in the Q&A.
Okay. So we have about 8 minutes left, and we have just a couple of follow-up items. And so if there are not any further questions, then we'll go ahead and wrap things up. I do want to thank you so much, Steve. We really appreciate this. The hands-on demo is really helpful, and the different use cases are exceptionally helpful. And we really look forward to hearing from you with additional ways that you might use this tool. We would love to hear that type of feedback. And please connect with us, either your regional TRC or one of the national TRCs if you would like to chat with us more about the application. But please also, if you have more technical questions or ideas around how we might enhance the application, please reach out to Steve. His email and his other website is here. His phone number is here as well. So please go ahead and do so. We would love to hear from you.
Yeah, please don't hesitate to contact me. I would love to be able to hear and engage a little further. We will have some additional support behind the app as we move along, but right now, if you have any questions or comments, please feel free to contact me.
Absolutely. Great. So if we want to go next slide, yep. So as you know, we do these national TRC webinars every single month. We typically do them the third Thursday of the month. However, with some competing events and schedules, we're going to get a little creative for the month of October. Please note that it will be Thursday, October 12th. So the second Thursday of the month from October. Our colleagues with the California Telehealth Resource Center will be hosting a webinar on telepsychiatry from 3 perspectives: child, adult, and direct-to-consumer. Should be fantastic. And the presenters are going to be Insight and UC Davis. So we hope that you'll join us for that. And next slide. And again, we really appreciate your feedback. I would love to hear what you thought of the webinar, how it was helpful, so that we actually have a link here. You will receive the copies of this presentation, but we have a link here to the SurveyMonkey to collect your feedback. Again, we'd love to hear from you and learn how we can make these more impactful in your work. So please take a moment, and it's very short, I promise.